Did you know there's a new nationwide study out of Sweden that followed over 2 million girls and women to evaluate their risk of breast cancer with the use of hormonal contraceptive? I'm Dr. Christine Marin. I'm a board certified physician. I am certified by the Menopause Society, and I've had a functional medicine practice for the last decade where I've helped women recover their health and hormones through a root cause approach. Here is the interesting thing that this study showed. They looked at women using progestin-only pills, and the progestin-only arm had a higher risk than the women who were using combined oral contraceptives, which included estrogen. And the women who were on a dose of estrogen that was slightly higher actually did better than the women who were on a low dose estrogen plus a progestin. All this points to the fact that estrogen seemed to attenuate or lower the risk of breast cancer in users of oral contraceptive pills. Here's the other really interesting part. This aligns with what we saw in the Women's Health Initiative study. So the WHI study came out in the early 2000s. It convinced doctors and their patients to stop using and prescribing hormone replacement therapy because we thought it caused breast cancer. Well, when they went and reanalyzed that data about a decade later, we saw that the arm of women using estrogen alone actually seemed to do better. They had lower rates of breast cancer than the arm who was using estrogen plus progestin. So the bottom line here is we need a more nuanced conversation around women's health and hormones and what it looks like to be on hormone replacement therapy or combined oral contraceptives or an IUD or whatever it is. We have options out there for you with more benefit and less risk than the birth control pill. Of course, they don't always provide contraception, so that's another discussion and part of the nuanced conversation you can have with your provider. But I love to arm women with knowledge because I want you to be empowered in all of your healthcare decisions and have more agency when you decide what is best for you and for your body.